Good afternoon, dear patients. Today I would like to discuss a clinical case involving taking a swab from the mouth. Taking a mouth swab for sexually transmitted infections is in fact a completely normal and routine procedure in our clinic. In general, after some casual sexual encounters and so on, many people examine their genitals, but they forget about the oral cavity and the anus if those areas were involved in sex. Specifically, this man had visited a sex worker. Since he was in a state of heavy intoxication, his sexual organ wasn't functioning, so to speak, and he ended up engaging in oral genital contact with the genitals of this woman, who naturally is highly infectious, or at least carries a high risk of transmitting infections. What did we do in such cases? Well, first of all, the contact happened 5 days ago, so he had been suffering quite a bit. Naturally, patients like this very often, become very attentive to their own sensations. Of course, he had some throat pain that he might not have noticed before. He supposedly had a scratchy throat and a slight difficulty swallowing. He naturally associated all of this with that very episode when, while drunk, he ended up having that kind of contact. In this case, since the genitals were not involved in the sexual contact, first of all, a throat swab was taken from this man. What is a throat swab usually taken for? Well, basically, according to the literature, it should definitely include gonorrhea, chlamydia, definitely herpes, candida, and it should also include Epstein-Barr virus, cytomegalovirus, and so on. We ourselves have encountered this, and there are even videos on our channel, more than one, about oral condylomas. Therefore, ideally, it is necessary to take a swab from the mouth and test for human papillomavirus. And finally, from my personal experience, I can say that we have found both mycoplasma and ureaplasma in the mouth, and we have checked this repeatedly, being surprised by such positive test results. However, these tests still came back positive. This raises the question of the possibility of self-healing after detecting mycoplasma or ureaplasma in the mouth. However, again, we took such a test from one of our patients with a 1-month interval, hoping that this, let's say, pathogen would go away on its own. However, it did not go away. It turns out that mycoplasma can live in the mouth for quite a long time and probably can indeed infect partners. Accordingly, to sum up, ideally, samples should be taken from the mouth for all infections except Gardnerella and Trichomonas. Therefore, the list of infections is quite extensive. Naturally, if only a short time has passed since sexual contact, blood tests will not yet show anything and should not show anything. In this case, post-exposure prophylaxis is indicated after a random sexual encounter following a swab. So accordingly, for this man, first of all, a swab was taken from his mouth for the aforementioned sexually transmitted infections, which all came back negative. Secondly, prophylaxis was carried out accordingly. In fact, many people don't know what STI prophylaxis is. You can watch a separate video on our channel for a more detailed explanation of what it is. In short, it's a course consisting of treatments, injections, and pills that protect against most sexually transmitted infections, which is exactly what was done for this patient.